Hello, I'm Dr. Jesus Perez. I am the Medical Services Coordinator for the Regenerative Medicine Institute. We are a multi-specialty group of board-certified physicians and allied health professionals who work together to advance the science of stem cell therapies and make them available to patients around the world. Our process uses adult autologous stem cells that come from the patient's own body. Because of this fact, these cells pose no risk of rejection. Our process is innovative in that it's less invasive and still provides a higher yield of stem cells than most other procedures. Most other clinics depend on harvesting stem cells from bone marrow or peripheral blood, while we found that it's much more efficient to harvest stem cells from fat tissue. Harvesting stem cells from bone marrow is extremely invasive and painful. Not only is it extremely difficult to extract suitable amounts of bone marrow, the cell yield is very low. If one were to extract 30 to 60 cc's of bone marrow, which is incredibly difficult and also very painful, the cell yield would be in the range of 7 to 14 million cells. In order to reach a therapeutic threshold, we found that we require at least 50 million stem cells. In order to get this number of cells from bone marrow, you would have to incubate and expand the cell population, which will take several weeks and only yield a copy of a copy of a copy of the cells and so on. When you extract stem cells from fat tissue, it's much less invasive and much faster. We introduce a tumescent fluid into the fat layer under the skin, which will actually make the fat easier to extract and also numb the area, making it much less painful. We usually extract 120 cc's of fat, which equals about half a cup. For eye patients, we only extract 60 cc's of fat. From that 120 cc's of fat, our average yield of stem cells is anywhere from 100 to 250 million stem cells, which is harvested over 90 minutes that it takes to process the fat, as opposed to 4 or 5 weeks that it would take to expand a cell population. These cells are then delivered into the patient's body, making our procedure not only less invasive, but also faster and more efficient. Each of the conditions that we treat are overseen by a board-certified specialist. Regenerative Medicine Institute researchers are working in conjunction with world-renowned research institutions in order to more efficiently deliver stem cell therapies. We feel this kind of collaboration is key in advancing the science and making it more widely available. We treat a variety of conditions, including Alzheimer's and Parkinson's disease, among other neurological diseases. We also treat patients with stroke, COPD, congestive heart failures, as well as retinal diseases and many others. For a complete list of the diseases that we treat, please visit our website. Success is measured on a case-by-case basis. Some patients have shown outstanding results. Since January of this year alone, we've treated well over 30 patients, all of which have shown marked improvement. Each of our treatment protocols has been peer-reviewed and approved by an independent review board. Our scientific advisory board includes physicians and researchers from prestigious and renowned teaching and research institutions all over the United States. For more information on our medical staff and advisory board, please visit our website. The difference between the Regenerative Medicine Institute and other stem cell therapy providers lies not only in the efficiency of our treatments, but also the setting in which they're delivered. As opposed to other groups which don't have access to emergency medical services, an operating theater, an ICU, or a large medical staff, all of our treatments are provided in one of the largest private hospitals in Mexico. We have 12 operating theaters, a staff of 150 doctors, as well as a 24/7 ICU and ER. Each of our 27 different treatment protocols are overseen by a specific specialist in the field, as opposed to having one physician treating a variety of diseases, regardless of whether or not he or she is trained to do so. Patients typically see results after about 2 or 3 weeks, with verifiable and measurable results occurring within 90 days post-procedure. We've recently been invited to participate with ASCR, which is a large network of research facilities, including universities and private laboratories, all dedicated to the study of stem cell therapies, all sharing research and experiences, which we plan to do as well. Due to our commitment to patient safety, we've submitted to review by ICMS, which is the International Cell Medicine Society. This is a group dedicated to holding clinics to the highest standards of treatment as well as scientific review. To date, we are the only clinic that has met all requirements set forth by ICMS. While this is still an ongoing procedure, we are the clinic that has gone furthest in the review process. I'd like to thank you for taking this time with us. For the Regenerative Medicine Institute, I'm Dr. Jesus Perez. For more information, please visit our website. Thank you very much.